Hello, I'm Jeremy Fernandez. Tonight on The Virus, a rise in infections fails to deter states from reopening some of their borders. Plus, a common drug comes to offer some hope in treating patients who are critically ill with coronavirus. But first, Victoria is at the centre of a resurgence of COVID-19 in Australia. The national daily number of confirmed cases has been on the rise this week after 2 weeks of 10 infections or fewer. Authorities say if this trend continues, restrictions may need to stay in place. Among those who've tested positive are a third Black Lives Matter protester and a very young child who attended a childcare centre while infectious. The Victorian Premier, Daniel Andrews, says he nevertheless is pressing on with plans to ease restrictions even more next week, despite the local clusters.
We believe we can continue to slowly, cautiously, safely reopen, but that is, to your question, that is reviewed almost every single day.
We would rather have less cases than we are having. Today's numbers, to me, are less concerning probably than yesterday's numbers, given the known links with most of these cases.
So here's how the caseload stands nationally. Those new Victorian infections have had a notable impact on the national figures in the past 5 days. We can also see how the numbers are trending upwards. It's been about 2 weeks, though, since most states started easing restrictions. However, the majority of new cases are still from travellers arriving from overseas and going into hotel quarantine. So, is the upswing in line with health experts' expectations? I spoke with Dr. Norman Swan earlier.
We predicted it actually, that round about the beginning of June, end of July, was a time when we'd be down to almost zero community spread. And in fact, that's what we are down to. Most small states are down to having virtually no virus. Now, we should just define our terms here because people get confused. Because the Prime Minister talks about suppression, which is not wrong, but you hear the word suppression being used, you hear the word eradication, and you hear the word elimination being used. So let's just work out what we're talking about here. So, and they think that New Zealand has eradicated the virus. So New Zealand hasn't eradicated the virus because they're getting people coming in still. New Zealanders are coming home with the virus, being quarantined. So there's virus in the country. The key thing is that what they've done is eliminated, by and large, eliminated community spread. So that's the thing we need to focus on. It's similar to suppression, but that's really the focus is not so much have we got 21 cases and there's 18 from overseas. That's not something to be anxious about. It's how many are community spread, and that's it. So Victoria still has community spread, very small numbers. It's arguable whether there's community spread in New South Wales, but there may still be at a very small level.
So we've seen, as these restrictions getting lifted, the number of cases and clusters in Victoria also on the rise. Is there something particular about the Victorian situation that makes it more exposed here? Why are we seeing these clusters appear in Victoria and not, say, in WA or the Northern Territory?
Well, we all know that Victorians are more friendly than other Australians. There's some truth to that.
They've got to keep warm.
They're more social. Well, not a silly idea that people might be indoors. I think Victoria's just unlucky. I think there's just more virus there. In theory, it should be New South Wales because more people have come in from overseas into New South Wales than Victoria, but a lot have come into Victoria. I think they're just unlucky. They're doing a lot of tests. And I think the meatworks was a big outbreak, and they've just had a couple of clusters. And this is a virus that needs a cluster to take off. And I think there's misfortune is in here as well. I don't think they're doing anything different or not doing anything other states are. So Victoria is struggling a bit, but it's still not a lot of virus. It might look like 2 days ago 21 cases, but I think within that there was 4 community spread. So it's not as if we're in double digits for community spread, we're in single digits for community spread.
It's not a lot in one view, but on the other hand, the impact that it causes in terms of lockdowns and shutdowns and social distancing and border closures is quite impactful.
Yeah. So what we've got to do now is get to a different kind of control. And that control it's kind of happening in Beijing at the moment, where you've got that big wholesale food market, an outbreak from there. You can't totally rely on what the Chinese, unfortunately, what the Chinese are saying because of what happened in Wuhan in January. And they're worried about it, and they're so worried about it that makes me wonder whether or not it's bigger than it actually is. But the traditional way, when you've got not very much virus in the community of doing this, sort of textbook public health is you find a case or an outbreak and you put a ring around it of 5 or 10 kilometres radius, and then you lock down or test intensively within that area, but you don't shut down a whole city or a whole state.
Obviously, in the last few weeks, schools have started going back and more students going back full-time. And we've seen outbreaks in schools where, you know, in New South Wales and Victoria particularly, schools have been shut down, students told to go home, the whole school gets a deep clean. So someone asked us, why are children still being sent to school, this is in Victoria, when they've had contact with people who are linked to infection clusters? And I think this comes back to your point about not necessarily knowing when someone's sick until you get the result retrospectively.
Particularly in children. So children don't often get symptoms, and therefore you don't know that it's circulating there. It's not an easy question to answer, and people are anxious about it, particularly if they've got elderly grandparents and you know, and this sort of thing. Let me just double back to the whole school story. So when, you know, I was talking early on, you know, that schools had to shut down, as others were too. The Commonwealth never wanted schools to shut down. The states were much more pro schools shutting down. But there were a couple of reasons why schools shut down. One was, to stop spread. So the reason that they say schools don't need to shut down is that you don't get that much spread amongst children. Well, it's not that you don't get that much. You do get some, but not a lot. It's true, and children don't get very sick with this. But it's not true that they don't get sick at all, because some do, and some children do die. But it's unusual and rare. But the main reason that you shut schools is that you can't go to lockdown with schools open. If you are wanting to get full social isolation and get control of a pandemic, schools have got to shut, because as soon as schools are open, you've got a lot of people circulating twice a day, picking up kids, taking them home, public transport. The infrastructure around schools requires a lot of social mingling. And so to get full socialisation, you've got to shut schools down. So opening them up when there's not much virus around is relatively low risk, as long as we're doing a lot of testing. And yes, the price you pay for that is that the odd kid will pop up now and again, child or student will pop up again with the virus. And yes, you've got to close a school for a few days to do that. But that's less disruptive than every school in Victoria or every school in Western Australia being shut for a prolonged period of time and everybody being on homeschooling. The price we pay for opening up is that, yes, we will see clusters, we will see outbreaks, and it will test the testing regime, and the testing regime will be very expensive because we'll do tens of thousands of tests for almost no positives. I mean, a general practitioner wrote to me today saying, look, I'm doing hundreds of tests on my patients, not one's positive. Well, that's actually good, and it's good that he's doing testing. But that's the price we pay, is that it will be broke out. But the risk is really low.
Another question on border closures. How safe would it be to travel by plane, train or even car in enclosed cabins once the borders do open? Even within states, I mean, WA's in the last few weeks allowed people to travel from the far north to the far south, and interstate borders are being opened as well. How safe is it to jump on a plane or a train to get around?
Well, I think until we've eliminated spread, then my view is that you should, in public transport where you can't socially distance, you should be wearing a mask. And I'm not quite sure why we're not doing that, because that would make it much safer. Because it's quite unusual, although we're talking about cleaning surfaces, before we did this program, people were coming in and cleaning the surface here, making sure that you and I are not going to get affected by surfaces. It's actually quite rare to get it off a surface. It's possible. But you catch it from droplets. So you and I are talking, we've got a safe social distance, but if we were here for an hour and a half during this program, this social distancing you and I have got would matter less, because you and I are talking fairly animatedly, and we could be exchanging virus even at a distance. So I think on a plane, people should be wearing masks. It's a very low chance, and that would reduce the risks quite dramatically. Someone's
written to us asking if we can expect a big drop in STDs and other types of diseases. So we're not talking about just black label diseases here, but because they haven't had a chance to spread at the usual rate in the usual forms of contact. Now, you've got that on one hand, and anecdotally you hear from people that, the hookup apps are going bing, 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 bing all the time. There are a lot of people looking for company on those apps at the same time. Do you have any data yet about how that's all playing out?
I looked that up this week. Largely, they report on STD. Most states report STDs on an annual basis. So I don't, there's a little bit of indication. I think it was from Queensland. So we did look it up just this week. We've got some questions on it, CoronaCast. Context. We were not doing well with STIs, sexually transmitted infections, in Australia. We've had in some states, quite large increases in gonorrhea and large increases in syphilis and small increases, but still increases rather than decline in chlamydia. So we were on an upward trajectory. Now, so just a slight to the side. Influenza. We had an early influenza season, and influenza notifications dropped quite considerably in March. Maybe because people weren't coming forward for testing, but it looks as if they dropped. Total number of influenza cases is roughly the same on average for this year as it has been on the 5-year average, because we had an early season before COVID-19 came along. So we might have been heading for a really big influenza season. STIs, you'd kind of expect them to come down for a while. But whether or not the pent-up sexual tension is now being released with casual sex, then you could see a significant upsurge as lockdown goes up. So you would not be surprised if it had come down. And people say, well, how do you negotiate COVID-19 in this sexual relationships or even relationships of any kind? So the first thing to be said is, a prudent new relationship with somebody you don't know, because you're going to have... There's a similarity between COVID-19, by the way, and sexually transmitted diseases. So I'm talking to you here, and the risk to me is everybody you've been in contact with in terms of...
That's right. I bring along my whole contact list.
As I do.
Yeah.
And so, but that's true in sexual transmissible diseases as well. So the modern thing is, if you're starting a new relationship with somebody, you should actually go to your GP and get an STI screen, so that at the start of your relationship, assuming that you're going to be faithful to each other, that you know what you come into the relationship with, and if you've got chlamydia, you get that treated. And you should be, if you're sexually active, because the highest risk sexually transmissible disease is chlamydia. It's only a urine test. You should be checked regularly for chlamydia if you're sexually active. That way, and you obviously protected sex. But what about kissing? Well, essentially, you need to check whether you've had symptoms of a cough or a cold or a fever in the last few days, or I have. And if you have, you socially distance, or you don't have a date that night.
Dr. Norman Swan there. So South Australia is lifting its border restrictions to travellers from Queensland. SA has already opened borders fully to travellers from WA, the Northern Territory and Tasmania, and now Queenslanders will no longer be required to self-isolate for 14 days when entering South Australia. No new cases have been identified in South Australia for more than 3 weeks. And hospitality venues can now have 300 patrons in total, but that's limited to 75 people per room. And the Northern Territory will open its borders to all Australian travellers on the 17th of July. People arriving from other states and territories will not have to quarantine at all. The date was set after the NT became the first Australian jurisdiction to achieve clinical eradication of COVID-19.
We are keeping our police at the border for 14 days after we open on July 17. That's one replication cycle. We'll be keeping a track of who comes into the territory, why and where they come from, so we've got an evidence base around things. So that leaves the architecture in place, the infrastructure in place, so we can make informed decisions as we go.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
8.5 million cases of coronavirus will soon be registered globally. The US is still the worst affected country, followed by Brazil. This week, India overtook the UK with more than 360,000 cases registered there. However, of the 450,000 deaths globally, India only accounts for 12,000. Millions of people are living under renewed restrictions in Beijing, meanwhile, after a new outbreak of coronavirus there. 60% of flights to the Chinese capital have been cancelled. Schools have closed and thousands of people are in isolation at home. Authorities are carrying out about 350,000 tests on people who've come into contact with about 160 newly detected carriers in the past week. Meanwhile, Swedish health officials have acknowledged the country has been, as they say, surprisingly slow at achieving herd immunity. The government had shunned lockdown measures adopted by other countries and kept schools, shops and restaurants open. But only 14% of people have tested positive for antibodies. By contrast, 57% of those tested in the Italian town of Bergamo had developed natural defences. More than 5,000 people have died in Sweden, giving it one of the world's highest mortality rates. British scientists are claiming to have made a breakthrough in the fight against coronavirus, identifying a drug that they think can save the lives of some of the most critically ill patients. It's a cheap and readily available steroid that's been in use for 60 years. In the study, the drug reduced deaths of patients on ventilators by 1/3.
Scientists in the UK have found the first life-saving treatment for COVID-19.
We had enrolled more than 2,000 patients on dexamethasone and we compared them to 4,000 patients who had standard of care. And what we saw was really quite remarkable.
Dexamethasone has been around for 60 years, a steroid used for treating arthritis and asthma, and there's no shortage of it.
It's on almost every pharmacy shelf in every hospital. It's available throughout the world and it's extremely cheap.
As part of the trial, the 2,000 patients were chosen at random to receive 6 milligrams of the steroid a day for 10 days. 35% of those on ventilators were saved. 20% of patients receiving oxygen also survived. The death toll in the UK, according to the government, is around 42,000. But new national statistics show it's far greater than that at 53,000, with 1/3 of all those deaths occurring in care homes. It's not a cure, but it will help some of the sickest COVID-19 sufferers around the world as scientists race to find a vaccine.
Meanwhile, unease is growing in the world's biggest refugee camp as the number of coronavirus infections continues to rise. Cox's Bazar in Bangladesh is a temporary home to almost 1 million Rohingya Muslims who fled violence in neighbouring Myanmar. Water and soap are in short supply and social distancing is practically impossible.
This is one of the most densely populated areas in the world. Up to 90,000 Rohingya Muslim refugees live in 1 square kilometre of land in Cox's Bazar on the southeast coast of Bangladesh. Some areas are in lockdown and there are curfews in place.
The COVID-19 pandemic is a crisis within a crisis.
29-year-old Sharif is among those taking refuge here from violence in his home country of Myanmar. COVID-19 poses a fresh threat to his family of 8 who live together in a cramped makeshift shelter.
We couldn't maintain social distancing in the camp because we live very close to each other, so it'll spread everywhere. That's why we're afraid.
Community leaders are training to help the effort to contain the spread, but the challenges are immense.
We are facing difficulties to hand wash because of a lack of water and we don't have any masks to use.
The first isolation and treatment centre with 50 beds has been set up and is bracing for its first wave of patients.
Already this ward is fully equipped with the beds already prepared.
There are contactless washing stations and more water and soap are being transported in.
This is a very difficult situation in the camp. We're trying hard to supply water facilities to Rohingya refugees so they can wash their hands frequently.
As the cases grow, so too will the challenges for people who have already suffered so much.
And if you'd like to see more of that conversation with Dr. Norman Swan, just check out the ABC News YouTube and Facebook channels. That is the latest from us. Thanks for your company. Stay safe. Goodbye.